Hello everyone. Today we will be giving a presentation on the Parkinson's disease. Name of our group members are Abita, Jade, Khalila, Ranil, Shiny, Vishal, and Walid.
Hello, welcome to our presentation. Today we will be talking about Parkinson's disease. In the table of contents, this will feature the introduction, which will have some background information on Parkinson's disease, its significance to an aging society, causes, symptoms, modes of prevention, and treatment. In the next section, we will have the article summaries. This will have an in-depth summary on the 6 articles related to Parkinson's disease, containing both qualitative and quantitative studies. In the next section, we will have the study conclusions. This will have an analysis regarding the study of each article, talking about the key findings in the studies, critiquing the methods used in each article, and discussing if further research would be required. In the last section, we will have the strategies and methods. Alternative strategies will be proposed that could potentially be more effective than the ones used.
Hello, I'm going to be introducing the topic of Parkinson's disease. Parkinson's disease is a chronic disorder that affects the coordination and movement patterns of a person and is heavily debilitating to an individual's everyday lifestyle. This is a neurodegenerative disease, thus leading to the breakdown of the neurological system, which in this case causes damage to neurotransmitters and affects movement. The disease slowly takes away from an individual's human function to freely move. Hence, it is important to learn what preventions can be made to allow the affected aging population to live as freely as possible when engaging in daily movement without severe hindrance and feeling of decreased quality of life caused by this disease. Symptoms of Parkinson's disease include shaking, stiffness, slowness, and poverty of movement. These symptoms contribute to decreased quality of life as the affected individuals over time are not able to participate in their usual necessary activities in their life. A common symptom is a resting tremor and is usually present in a lower limb, but may also be seen at the lip, jaw, or tongue. Diagnosis includes observation of history and a motor pattern examination. This consists of changes in walking patterns, handwriting, and responsive reaction time exercises. These observations, in addition to the observation of dopamine deficiency causing damage to the nervous system, directs to the diagnosis of Parkinson's disease. There's no current cure for Parkinson's disease, as symptomatic therapy for motor symptoms is used as treatment. Currently, the top treatment since the 1960s is levodopa, which leads as the most utilized form of therapy for this chronic disorder. Modes of prevention include physical exercise to build neurological connections and performing movement. Exercise will help prevent increased slowness and lack of coordination. Physical activity will also help improve balance in the gait cycle to assist in the prevention of falling, which is important for the safety of those who are older in age. To further assess the future direction of Parkinson's disease on an aging population, we must assess the current research and their validity to find more forms of treatment to aid in the relief of this chronic disease.
Did you know Parkinson's disease attracts 1 in every 500 Canadians, as over 100,000 Canadians are currently living with Parkinson's, with a gradual increase of approximately 7,000 new cases annually. An estimated 4 million civilians worldwide have Parkinson's disease.
The main goals of this study was to identify the palliative needs for Parkinson's disease patients, the relationship between health-related quality of life and palliative needs, and the factors that affected a patient's health-related quality of life. Researchers recruited patients through the American Parkinson's Disease Association, while neurologists were recruited through the National Parkinson Foundation, Medical Association of Georgia, as well as neurology clinics. All participants were surveyed on palliative needs, and a group of patients were interviewed as well. Quantitative data was analyzed through SAS 9.3 software and a MANOVA analysis, while qualitative data was studied using preset codes. Results showed that patients and physicians reported significantly different levels of needs. Physical and psychological categories indicated a higher effect on quality of life, as well as a need for improvement in care coordination and healthcare education. The study showed that the needs of patients should be put as a top priority, as non-physical care for patients were deficient under neurological care. The objective of this study was to examine the relationship between Parkinsonism, its wide range of adverse health effects, and neuropathology. A structural clinical evaluation was done using participants' medical history and a neurological examination. 4 Parkinson's disease effects were tested using the motor portion of the Unified Parkinson's Disease Rating Scale. The Cox Proportional Hazards Model helped identify the association between Parkinsonism, possible Parkinsonism, and its adverse side effects. Results showed that about 25% of participants had Parkinsonism and 30% had possible Parkinsonism. Parkinsonism depicted strong relations to factors such as age and mild cognitive impairment. Those with possible Parkinsonism showed an increased risk for poor health. In all, the study indicated that Parkinsonism had a connection to the aging population, increased risk of adverse health effects, and a post-mortem indices of brain pathology. The last article chosen outlined evidence of palliative care for Parkinson's disease. Unlike other articles, this research study summarized the findings of other articles to indicate what is known, unknown, as well as future suggestions. Recurring themes in studies indicated issues such as changes in social roles and financial difficulties, as well as the need for palliative care from diagnosis. Information still unknown followed the lines of timing for palliative interventions, factors that affected specialist referrals, and management for terminal care. Many studies found the palliative phase as the final stage, which in reality should be something that is done earlier on. An emphasis on the collaboration between neurological and palliative services is also being looked into. For future research, studies suggest to focus on palliative care and regulations of symptoms, as well as switching from a traditional prognosis model to a fully integrated needs-based model instead.
From this, we conclude that the traditional model is not helping with the needs of current patients. Palliative care for PD will interest patients, clinicians, and caregivers alike. New model upholds maximum patient autonomy, and following will be crucial to improve the new model, patients' complaints, and the sensitive method of assessment. Now I'll be briefing you with the comparative conclusions of the qualitative studies. From the qualitative studies we analyzed, we observed that the traditional model does not work in the patient's best interest. There should be transparency between neurologists and patients. Parkinsonism is linked to aging and greater risk of poor health. Creation and maintenance of a patient centered model is necessary for maximum patient autonomy.
The objective of the study is to determine if there is an association between physical activity and the risk of developing Parkinson's disease. Participants were given a questionnaire where they were asked to provide information on how much time on average per week they did certain types of physical activity. Each of the activities was assigned a metabolic equivalent task value or MET value. This value was used to find the average energy used per week for each activity. These values were found for total recreational physical activity, light, and moderate to vigorous activity. These values were categorized and analyzed using various models such as age stratified Cox proportional hazards model. Results showed that those who reported moderate or vigorous activity displayed a lower chance of developing PD by 40%. Men displayed a great decrease in the risk of PD with moderate or vigorous activity. For women, this was only true for vigorous activity.
Parkinson's disease is caused by multifactorial reasons, such as environmental factors or genetical reasons. The results that we got from this article suggest us that vigorous physical activity will prevent older adults from getting Parkinson's disease. The study suggests to have advanced physical measurements to get more women involved into studies to compare the causes of Parkinson's disease and get more clarifications from biochemical pathways for our future studies.
The objective of the study is to determine if daily physical activity influences Parkinson's disease rates and the rate of disease progression. Participants were categorized and the severity of Parkinsonism were obtained from the results from the modified version of the United Parkinson's Disease Rating Scale. A monitor device was attached to each participant's wrist to record the amount of physical activity done. A linear mixed effects model was used to assess whether total physical activity influences the rate of change of the disease severity. Results show a strong relation between total physical activity and its intensity to the incidence and progression of Parkinsonism. Those with higher average physical activity and intensity displayed a lower incidence of Parkinsonism and slower progression of the disease.
The findings of this study indicate that the older adults who live a more active lifestyle may have a lower risk of developing Parkinson's disease and a slower rate of progression. These results support public health campaigns to motivate older adults to live a more active lifestyle in order to prevent or postpone the onset of late-life motor impairments. However, further research is required to discover the mechanism behind the possible motor benefits of a more active lifestyle.
The objective of the study is to determine if driving performance is influenced by Parkinson's disease. Participants answered the questionnaire prior to the test and rated the road course's difficulty after the test. Each participant drove on a road course with an occupational therapist and a driving instructor present who evaluated the participants on 7 items and overall safety. Independent Group T tests were used to evaluate the data from the driving test and the questionnaire questions answered on a scale to 1 to 5. Other questions were analyzed using the Mann-Whitney U test. Results showed the control group had better driving skills and were significantly safer drivers than the group with Parkinson's. The Parkinson's group reported to have driven less distance and reported to have difficulties with things such as reading road signs in the daylight and steering in comparison to the control group.
Clinical implications. Drivers with Parkinson's disease require guidance on the disease's possible effects on driving, need regular monitoring, referral to occupational therapy driving assessment programs to evaluate fitness to drive or the need for driving rehabilitations. Targeted driver retraining can be beneficial too. Drivers with Parkinson's disease are less safe to drive as a group than age-matched controls. Standard clinical markers are unable to predict driver safety than with any certainty. They also back up Redford findings that patients with Parkinson's disease have poor junction observation, poor road positioning, and poor roundabout driving. According to the results of the questionnaire, the drivers with Parkinson's disease in this volunteer sample limit their own driving patterns to a minor extent, driving as much as controls, but traveling less kilometers and driving alone less often. Quantitative conclusion similarities. From the quantitative studies that we analyzed, we learned that there's a strong relation between total physical activity and its intensity to the incidence and progression of Parkinsonism. Those who indicated mild to heavy exercise had a 40% lower risk of developing Parkinson's disease. Men showed a substantial reduction in their risk of Parkinson's disease when they engaged in moderate to vigorous exercise, while this was only true for women when they engaged in vigorous activities. As for the assessment of driving performance, the test group had superior driving capabilities and was considerably safer than the Parkinson's group. They suggest regular monitoring and targeted driver retraining for drivers with Parkinson's disease.
3 strategies that can be used when looking at the onset, the diagnosis, and the progression of Parkinson's disease include earlier palliative care, more education to the community and caregivers, and encouraging an increase in physical activity in older adults. When we talk about earlier palliative care, we talk about a better understanding of the appropriate timing of the initiation of palliative care in these patients. There's likely a need for earlier palliative care than most are already receiving. More thorough support for the families and caregivers of those diagnosed, beginning at the time of diagnosis and continuing until death. Caregivers struggle to provide care while simultaneously caring for themselves and others who may depend on them, as we learned in lecture and through the Caregivers Club video by CBC. According to Richard et al., 2013, the need for complex questions of patients with Parkinson's disease and their caregivers are often failed to be properly addressed. In the same article, it is stated that with regards to PD, the traditional methods of determining when to begin palliative care are not as useful. That is from the article by Richard E. et al., 2013. This supports the idea that earlier palliative care would be the most effective way to approach care after a PD diagnosis, and brings us to another strategy, introducing more educational support. Introducing more educational support within society for young and unaffected members may help to prepare for the onset of PD within families, as PD is likely to become more prevalent in an aging society, according to Buckman et al., 2015. Implementing educational and support-based groups for members of the community will assist caregivers in providing better care to the patients and will help educate and prepare the rest of society for its aging population. When encouraging an increase in physical activity in older adults, we can look at an article by Ovesgarin et al., 2019, which states older adults who engage in an active lifestyle are less likely to develop symptoms of Parkinson's disease or for the pre-existing symptoms to worsen. This evidence suggests that by encouraging physical activity in older adults, we can help to cease the progression or the onset of the disease. A strategy that could be used by physicians would be to prescribe a certain amount of physical activity daily or weekly to patients who are at risk for developing PD or those who are already showing symptoms. This would help the patients to understand the importance of physical activity in maintaining their health. Thacker et al., 2008, supports the evidence for the importance of physical exercise in PD patients, stating that those men and women with the highest baseline of physical activity had the lowest risk of PD at follow-up appointments. The same article states that moderate to vigorous exercise is more effective than mild, so aerobics, cycling, and other similar activities should be the ones suggested to PD patients.
This is the list of the references of all the articles we have used for this presentation. Thank you.